Welcome, everybody. Thank you so much for joining us today. It's lovely to see we've got a good number of attendees, some names that are familiar to me as well, which is always lovely. For those of you who don't know me, I'm Alice and I work in the support services team alongside my colleague Anna. So the session is on scar therapy, and we're going to be joined by Emma Holly from Restore Therapy. So Emma is a leading specialist in scar therapy. She provides education around the world for health and wellbeing professionals on this topic. She has a clinical practice at 10 Harley Street, and she speaks about scar tissue at conferences and symposiums in the UK and abroad. So I'll pass over to Emma in just a minute. Just for any of you who might be quite new to Overcome, not so familiar with what we do, a brief introduction to our support service. So you can get in touch with us on our phone number, you can drop us an email, you can even arrange a one-to-one Zoom conversation. And that can be, if you've got a particular question in mind, a piece of information that you're looking for, or sometimes because you want to just have a bit of a chat and talk things through. That's exactly what we're here for. Shortly, I'll post all of our contact details into the chat. And of course, you can also find those on our website and the emails that you might receive from us as well. At the end of the session, we'll be hosting a Q&A session. And the way that that will work is that you can type any questions either into the chat box or the Q&A. Both of those you can find at the bottom of your screen. So one says chat and one says Q&A. They're on either side of that green button. You can use either. You don't need to wait until the end to type your question. So if something occurs to you and you don't want to forget, do feel free to kind of type in questions as we go. But just to help the presentation run smoothly, we'll come to all of those at the end. We won't read out your name. So again, don't need to worry from that point of view. If you want to ask a question, that will be completely anonymous as well. And just to highlight really that, Emma is really happy to answer, general questions related to this topic, but she's not here to give an individual clinical opinion. So do try to ensure that any questions that you ask will be of benefit to, the group of us that are here today. I think that is all. Yeah, just checking my notes. I think we've covered all of those introductory bits. So I will pass over to Emma, who's going to run through her presentation, and then I will rejoin you all with the Q&A at the end. Thank you.
Hello, everyone. Lovely to be here, and it's amazing the work that's being done by Overcome. So I'm really delighted to be able to come on. And a bit like Alice mentioned, a lot of people haven't had much support with their scars, and even though lots of people are going through big operations, it's not unusual for people to feel frustrated that they haven't had a lot of scar advice, and that's often something that I hear. So hopefully you'll learn something new in this presentation that I'm going to give. But I also kind of like to start off by reassuring people that it's actually quite normal that they won't have had lots of scar advice, so that they don't leave the presentation thinking, oh, I wish I could have done a bit more, and I wish I'd known this earlier, because actually it's been my kind of passion and commitment to actually try and get this information out to more people. But it's been a bit of a battle, and it's ongoing, and it's amazing to have opportunities such as being able to present to you today through Overcome, in order to make sure that more people hear about just simple ways that they could look after their scars, which might help with symptoms and things like that. So I'll just click on my presentation if you give me a moment. Let me make sure, hang on a minute, just to make sure I'm screen sharing properly. You know what it's like. You think you've got it all sussed and then it goes wrong at the last minute. Let me get my screen sharing done. Yes, there we go. And I shall press play. Alice, can you just confirm that's all playing for you?
You can see your desktop background at the moment rather than the slide.
Oh, okay.
You just need to click onto those.
That's
it. We can see them now. Yeah.
Thank you. Technology, always the best thing, isn't it? So yeah, I'm going to be talking about scar therapy, which is my specialist area, and how it can help you guys. And I've already had a bit of an introduction, but just a little bit about me, just to say that my background is originally actually I trained as a massage therapist. It was 30 years ago now. So I've really done a lot of advancement since my original training in massage. But when I first discovered that people had complications after surgery and after injuries with their scars, that's really been the focus of my career. And I've actually really done a huge amount to try and get lots more people getting access to and finding out about scar therapy. I've been doing lots of work with charities and with therapists based at the NHS, and finally getting the opportunity to speak at some important conferences so that medical professionals can actually understand what simple advice the surgeons and the clinical nurse specialists could be giving people when they're being checked out of hospital, so that they can have a little bit more support with their scars. So that's what I'm all about. And I teach therapists around the UK as well. What am I going to talk about? So what is a scar? And I'm also going to talk about scar adhesions and how they can impact us. There are a few pictures of scars in this presentation, just to let you know. Hopefully it won't be too upsetting for anyone. What pressure to use. So a lot of people say, oh, I've been told to massage my scar, or I hear it's good to massage my scar, but I'm not quite sure what pressure is best to use. And we can talk about a couple of techniques. And then I'm going to talk about whether or not you should be doing your massage on your skin while it's still dry, or using an oil or a cream. And we can also look at some creams and oils and silicons and how they can help scars. So talking about those products and which one might be right for you, whether or not it's worth you using a product on your scar. And then, you know, if you come off the back of this and feel actually you really want to see somebody who's professionally trained, how you could access finding a person who's trained to deliver some scar therapy, with some different options for you there as well. So hopefully that'll be useful. So everyone who has a significant injury is going to end up with scar tissue. So we can't stop people getting scars. And even if you have scar therapy, you're still going to get a scar. It doesn't stop the scar, but what you can do is you can try and make sure that that scar tissue is as functional as possible. And during wound healing, like after you've had your surgery, your body naturally just kickstarts its own healing process. And if we talk about things that we can do to influence a scar, actually what we're doing is we're influencing and tapping into your body's own powers to heal itself. So, you know, you've already got the resources in your body, but sometimes when there's lots going on and the body can get a bit sluggish and kind of forget that there's perhaps still a bit more work to be done, and that can affect how people's scars look and how they feel. So when I talk about a scar, I'm not just talking about the line on the top of the skin that you're left with. Scar tissue forms deep inside all of the layers of tissue that have been cut and have had to repair. So if somebody comes to me for a scar therapy appointment, I'm not just limiting treatment to their skin. We're doing deeper treatment and wider treatment all around the areas which may have been impacted during their surgery, or if they had an injury during their injury. And it takes a really long time. I think one of the big things is people often think, oh, well, you know, my scar's going to look like this for the rest of my life, and maybe they're 6 months or 8 months after surgery. But just to remember that your scar naturally actually does a lot of healing in the first 6 months, and then it slows down, but it is still healing. And you get sort of slowest changes going on. It's called remodeling. So you get a remodeling or a changeover of the cells, which are where your scar is. And that takes a really long time. But don't forget, all of our cells in our body are slowly changing over and getting replaced all of the time anyway. So even if perhaps you had your surgery much longer than 2 years ago, it doesn't mean your scar can't change, because when we stimulate the body, we can stimulate that natural healing to kind of like get started again, and we can often create softening in scars or try and improve the textures or the feel or some of the symptoms that you may be having. The other thing that is really, really important that doesn't really get talked about a lot is scar adhesions. So scar adhesions is where you get these fibers that stick together bits of tissue that are normally separate. And these again, it's not necessarily something that you can have a big influence on, but it's really important to know what they are and kind of how they can affect you, because it might be giving you some symptoms. And one of the things is inflammation is a big contributor to adhesion. And if somebody perhaps had a post-surgical infection or had quite delayed healing, that would mean that they probably had longer inflammation or a bit more inflammation than normal. So that puts your chances of developing these kind of like sticking between two scars, structures within the body. So you can have adhesions which might give you digestive issues because it's got a bit of tissue sticking onto your small intestines, as it's shown here in this picture. But they can also affect how you look, perhaps when you're standing up, creating sort of tucks and folds. Because if you've got adhesions which come right onto the surface of the skin, they're kind of like pulling your scar in a little bit, which can affect body image and function as well, because it might make you feel tight if you try and stretch in a certain way. Sorry. Then the other thing to think about is what causes it. You get this protein that gets released when your scar's healing, and it sticks things together, which is what you need when you're first recovering from a surgery. And because it's sticky, that's what can lead to those adhesions forming. So like I say, it's not something that we can necessarily do anything about at this stage, but it can cause symptoms, and it can help you understand perhaps some of the way that you might be feeling. Your medical team may not be able to tell if you've got internal adhesions, because it's really hard. It's not something that they can just give you a quick scan and go, oh yes, you've definitely got adhesions. So normally it would be something that they would be able to see if you had to have another surgical procedure where they opened you up, and therefore they would see that there's a lot of adhesions or a lot of internal scar tissue that's formed. So I didn't want anyone to sort of panic and go rushing back to their medical team and say, oh, can you check me if I've got adhesions? It's just helpful for you to know that this is something that can happen. It might be the reason that you're feeling these kind of symptoms, and it's because of adhesions that I'm going to suggest in a little bit that maybe you might consider doing a bit of stretching on your scar, because if things are all kind of stuck together, if we can keep things all nice and stretchy and moving, then that might help minimize your symptoms or stop you getting symptoms in the future. How might they impact us? So when you've got things that are adhered, a bit like this picture shows, she's got a very small, neat scar. It might impact you by actually creating a bit of an overhang, or impacting how your scar kind of looks and is tucked. And when somebody comes in with a scar like that, if I could show you what I can sort of feel with my hands, it's the image on the side. So I can kind of feel that there's a lot more denseness to the tissue, and there's often kind of like pulling going a bit further away from the scar as well. So this person might come in, and when you sort of get your hands on and start assessing them as a therapist, you can really sort of feel a few different things. And what I might be listening for in the consultation is that they might be talking about that they've got like a bladder problem, that they've got frequency of urination, because that's right down at the bottom there. So they might have some adhesions onto their bladder. They might be having pelvic floor or diaphragm issues, because actually there's a relationship between the pelvic floor and the diaphragm. But actually they might be walking in and saying, oh, my knee really hurts, because actually if things are sticking around your hip and in your pelvis, sometimes that doesn't present in that area. It can actually come as a feeling in the body somewhere else, because if things are a bit twisted into your hip, that can affect how you walk, and that can actually give you knee pain or hip pain, and it can affect the alignment of your pelvis. So from a sort of therapy perspective, I'm thinking about, how do I treat the symptoms? How do I soften the scar tissue? How do I kind of get everything feeling a bit more comfortable for the client that I'm working with? And the way that I do that is using scar massage. So doing hands-on work around the area. And massage is something that really can help keep the scar supple and mobile, so make it a bit softer and help with, if it feels really firm and a little bit stuck, it can help soften that up and get it moving a bit more. It can help also with mature scars. I have people who come into clinic who've had scars from surgeries or injuries which are more than 20 years old, and they can still have changes. But ideally what we want to do, and the purpose of having opportunities like this to talk to individuals, is to try and make sure that when your scar's newly healing, that you get as much support as possible, so that you can kind of stop as many of these issues before they develop. If you're going to do some massage on yourself, I always say little and often. If you come for a clinical appointment, they tend to be sort of 45 minutes, 60 minutes, 70 minutes. But realistically, I don't think many people have got that much time to massage their scar for long periods at home. And also, it's more awkward. Your hands can get a bit stiff. So just little bits of stimulation are really quite helpful. And we're going to talk about how to massage your scar, and I'll give you some ideas and tips as well. So you may have even been told by somebody in your medical team that you should do a really hard massage on your scar. This is a more historic opinion of how scar tissue needs to be treated, because it is quite stiff. The old-fashioned opinion was that it needed really, really hard, aggressive massage in order to get it to be softer. But actually, more and more research is showing, and I can definitely say from my clinical experience, it's the gentle touch that actually really does bring great results. It's much more comfortable for the individual receiving the scar treatment, and it's at less risk. So the reason that I don't like people to do aggressive hard scar massage on themselves where they're pushing really hard is that actually, even if your scar's old, that can bring up new inflammation. And a bit earlier on, I was saying, well, inflammation is one of the reasons that you can end up with scar tissue and adhesion. So we don't really want to do that. We don't want to aggravate your scar, so it actually makes more scar tissue underneath the skin. And it can increase the chances of getting these really big scars. They're called keloid scars, which really grow quite high on top of the skin, because that can be the problem when you get lots of inflammation. And potentially, if you've got lots of lymph node removals, it could increase the lymphedema risk, because you're putting extra strain on the body and causing inflammation again. And it can feel painful, and very much, if you can get results without causing pain, why would you do something that's painful? So lots of people may have pain when they're doing it, and they can also have increased pain afterwards if they have a really hard scar massage. And so we don't want to cause more scar tissue. On the other hand, gentle scar massage can actually reduce inflammation, make you feel more comfortable. It can be calming. It can reduce tension that's in your skin, that's in your fascia, word you might have heard of, that's kind of like pulling on your scar. And those things can be actually keeping your scar in a state where they're really inflamed. So if we can get everything feeling more comfortable, that can actually make your scar happier, which allows it to reduce some of the symptoms you might be feeling. A gentle scar massage, you may be surprised. I have people falling asleep on my therapy table, smiling at me and saying, oh, this is actually quite nice. So having a nice gentle scar massage can actually feel really good. It can promote those feelings of well-being, support your emotional recovery, because a lot of people will say, oh, I don't touch it, and I don't let, my partner touch it, and they've only ever had touch from medical professionals, which has been perhaps quite uncomfortable, or has felt really, really kind of like clinical and medical. And actually the power of actually touching somebody gently and kindly and sort of in a nurturing way, which is what should happen if you come for a scar therapy appointment, can be really profound. You do get the odd person shedding some nice happy tears, because it's the first time that somebody's actually touched them in a way which feels really good and makes them feel listened to on a physical level, as well as listened to because you're there as their therapist to hear what's going on for them. And scar massage can soften that scar tissue, not only what's on the skin, but what's underneath as well. And people often have this misconception that in order to target the stuff that's really deep, you have to push very hard. But the point is, there's a connection right up to the surface. So actually you can get some quite powerful changes without having to be aggressive. And the other thing that people often ask is, should they be using sort of creams and things? So emollients is another word for like a cream or an oil. So something that's a lubrication. And there's pros and cons. So if you use an oil or a cream during your massage, that can be really good because it hydrates the skin. And I'm going to go on to talk about how important it is that you need to massage some creams into your scar for sure, regardless of whether or not you're going to do some dry massage as well. And the emollient makes it really easy to kind of like slide across the skin surface, and it may be something that you're familiar with doing. So if you regularly moisturize your body, rubbing your skin with a kind of nice oily, creamy feel may be familiar, and that can be really nice, particularly if you're doing it for yourself. So those soothing, relaxing, sort of familiar things. But the minute you've got an oil on, you can't really stretch the skin. And I'm going to talk about that importance of giving it some stretch. So if you think that you have a scar that's maybe creating a bit of an overhang or is really sort of tucked in, or you're limited if you try and like bend to the side, one side's a lot more limited than other, or if you try and do some sort of rotational movements, if they're really more challenging for you, then I'd say definitely think about doing some dry massage, because you can actually do some placing your hands on the skin and moving, sort of stretching the skin and the scar, which can create a good stretch. That can improve the tissue mobility. And you can have a bit more friction, which can be kind of like create a different stimulus, which can be quite nice for the scar as well. In an ideal world, you do a little bit dry, and then you get your cream, gel or oil or some silicone and put that on, so that you've also got that emollient and that sort of nurturing of the creams as well. But yes, as I say, we really need to think about getting some moisture into your scar if it's under 2 years old. If your scar's more than 2 years old, hopefully by that point your skin's all repaired, unless it's still red raised or very discoloured, or darker coloured if you've got darker skin tones, and raised, the products are going to have much less impact at that stage. But if you've got a scar that's less than 2 years old, it's definitely worth trying some products on them. And if you've got a scar that's under 6 months old, I really want you to be using some kind of moisturizer every single day, ideally twice a day. When to start? As soon as the scabs are gone, and keep it up. So all scars will benefit from moisturizer, or silicone, or oil. You know, there's different things that you can do. And the reason that they need that is that when your skin's been broken, one of the things your skin does is it keeps moisture, locks moisture into the body. And when you've got like a really immature scar, so when your skin's newly healed, basically you will be losing moisture, because the skin won't be yet strong enough, if you think of it as a new patch of something that's not yet very thick. You've got moisture loss in the body, and actually that drives that area to feel irritated, and that often presents as symptoms like itching, can feel quite painful. So actually just a simple moisturizer can really make a big difference to things like pain. Then you've also got to think about if you've invested in some nice cream, or you've got on prescription some really good scar cream, don't spend too long rubbing it around, because you're actually then spreading it more and more thinly on the area that needs it. So a bit like I said, I'm going to show you some dry massage techniques. You might want to do those, and then literally like put the cream on the area, if you've got a specific scar cream, and then just let that soak in. Oils tend to go a bit further anyway, but again, that idea that you don't want to make it that you're actually putting it on and then rubbing it all off. If you can, moisturize 2 to 3 times a day, particularly in those first 6 months, but try and keep it up at least once a day for the first year or two. And the other thing is, depending on whether or not you think you're going to get out in the sun, but if you have any scars that are in a part of your body where you're going to expose them to UVA and UVB rays, make sure you get some SPF on them as well. When it comes to like creams and things like that, there are really, it can be overwhelming how many different products there are on the market. When I'm training, I tend to say I recommend things which have had some research into them, but lots of products are really lovely and just haven't got research into them. So this green and the purple brand that I've got there, and I've got some here in the background. I'll turn my screen off, the presentation off in a minute, and show you. Like, they've been included in some studies and they're really, really good. As a good start, I'd start with a cream, but if you've got more symptoms, like your scar's really quite big, as in sort of raised, or you've got very bad discoloration on it, you might want to think about moving on to a gel. And the products on the right there with the pink, the Cica cream and the Cica oils, like, they're really nice scar products as well, with lots of ingredients that should be really helpful to nourish your skin. But why am I talking about stretching? So if you think about these different layers that we've got in our body, with the superficial bits of the skin, and then we've got this sort of deeper layer of the skin, and then you've got your muscles and everything underneath. If we stretch things, we can help minimize that sticking and promote length in those fibers of that scar, particularly as it's healing. So lengthening those fibrous bands of scar tissue as well. And tension on the scar. So you could get pulling from your scar, which makes other areas tight. And so actually stretching everything around, as we know, if we wake up and do some stretches, they tend to leave you feeling a little bit more loose and relaxed. And it's the same, but on a much smaller scale when it comes to scars. And you really want to encourage those gliding layers of the scar as well. So I'm going to turn this off for a second so I can talk to you about some different movements that you can do. Has everyone got me big on their screen? Hopefully you can see. Alice, can I have a quick okay that I should be that now I'm big on the screen?
Yes, sorry. Yeah, you are.
Yeah, because if it's very small, it'd be hard for you guys to see. So in that presentation just there, I was talking about silicone, and silicone comes in different ways. So silicone can be a bit like a sticky plaster. You can, this side's harder to see, but you can get some that are sort of see-through. You can get like kind of like different coloured ones and different shaped ones. And you can also get a really big one and get them cut. And these silicone sheets, which are also, they're quite expensive. To get one for a big long scar down your abdomen, you're probably talking, if you bought it privately, anywhere from 30 to 70, 90 pounds even. But if you've got problems with your scar, you might be able to get it on prescription. So it's worth going back to your medical team. They also sell them on places like Amazon, and there's cheaper ones available. These tend to be a little bit less stretchy, as in like they might start to peel off because they haven't got quite as much elasticity, particularly if it's on your abdominal and pelvic areas, because we move around a lot. Each time you bend and twist, the cheaper ones can often start to become undone, and sometimes they're very, very, very thin and actually a little bit too narrow. What ideally you want is that your scar sheet will be a very minimum of 3 centimeters, but on a big abdominal scar, I'd tend to go a bit wider. I tend to go more like 5 centimeters. So something more like that size. So if I put up my hand, sort of a nice big wide sheet would be good. If you've got a bit of your scar which is a bit more raised, but the rest of it's actually healing really nicely, so it might just be a small section, I would, to make it more affordable, I would perhaps buy one of the bigger ones, and then you can always just cut it in sections and just put it on the bit that's actually a bit raised. If you're going to think about trying silicone, then you really want to only bother to do it if you're going to do it daily for a minimum of 6 weeks. So it isn't something that you could try for 4 days and go, okay, that's working or not working. It works because it's actually providing a little bit of compression to flatten your scar. If your scar's at the minute a little bit raised, so if you run your fingers over your scar, if it's a bit like a bump in the road, then then it's a really good idea to try silicone if that's bothering you. You could try some cream first, which is kind of easier, and if it's not starting to flatten, you could then go on silicone. So that's really helpful. And like I say, silicone can be available on prescription, but it might be a bit of a postcode lottery. But it's one of the best things for making your scar go flat if your scar's currently raised. It does come in a gel form. So this will look like just a completely clear, like a transparent gel. I don't know if you probably won't be able to see it because it's transparent. And if you get a gel like that, again, you might be something you've been given already by your medical team, or you've got some at home, just slide it along the scar and then leave it. Don't spend ages again rubbing it in. And if you find your skin is still tacky, then it's likely that you just put too much on. So put a little bit less on next time. With the different kinds of kind of creams and things like that, again, make sure that they're unperfumed, that you haven't got an allergy to it. So before you put it on a sensitive area like your scar, maybe just put it in the crease of your elbow or behind your ear, a bit like you might do if you were going for a patch test for using hair dye or something like that. Because the worst thing you want is to get a skin reaction around your scar. But the creams can be they're definitely a good starting point. Going on to like an oil, so this is like an oil in a little spray. There's lots of oils which are made for scars, which are really, really good. They actually can contain ingredients which can help nourish your body and support what's needed in those deeper layers of the skin as your scar's healing. And if you like doing massage with something that feels a bit slippery, if you like that feeling of a little bit of moisture, oils are much better than creams, because if you put a cream on and you've got quite a big scar, you can find that actually your skin's going dry quite quickly. So it's thinking about what's right for me, but just get something on it rather than don't get anything on it. And then lots of people say to me, oh, I don't like touching my scar, so I'm going to give you some options for that. So if you go onto like one of the Amazon, sorry, I don't mean to plug Amazon, but Amazon or eBay or one of those things, you can get these like little cupping sets. So I like the one that comes with this little silicone facial brush. It's really soft. I have seen silicone facial brushes in Boots, but they tend to be quite a bit stiffer. And what I want for your scar is one that if you touch it, feels quite smooth, like it bends when you go onto it. So that's just got some, it's almost like little hairs on the top. And this is really good because you can put it on your skin and it kind of grips the skin and moves it around. So if you were massaging your scar, you put it on and then you slide it from side to side, and actually it's moving your skin a little bit. So it's creating little tiny stretches on your scar, which is what we want. Or you can try with the little cups, which can create a little bit of a lift up. So they can help pull, if your scar's kind of like got a bit of a fold in it, or it's stuck down, or it feels quite dense underneath. If you feel, oh, it's like there's a thick nodule in there, then these little cups, you give a little squeeze, let go, and your skin gets pulled into the cup, and then you squeeze again and come off. So don't hold it up for too long. So just squeeze, put it on the skin, your skin gets pulled up, squeeze again and let go. And again, you can just work up and down your scar as long as your scar is fully closed and has been for at least 4 weeks before you start the cupping, because we don't want to put too much pressure on a really new scar and pull it apart. But once you're past sort of 10 to 12 weeks, you should be able to use the cupping. And there's a really small cup, because sometimes when you go around the tummy button, it can be a bit awkward with a bigger cup. And although it doesn't feel very strong, it's a very, very gentle pressure. These little cups are really, really handy, and they can really make a big difference to how that scar looks. There's also tools that you can get. So this is called the scar wand. It does look a bit scary because it's a big metal thing, but if your hands get tired when you're massaging, particularly if you've got a long scar, this is quite nice because you don't have to do it very hard. You can just do some nice light movements on and around, a bit like you're a very fast windscreen wiper. So you're not trying to push down into your tummy or into your pelvis at all. You're just sitting on the top of the skin. You can go over your scar and around your scar, and you can do some little circles, and you can use this with cream as well. So you can just do some nice light movements. That can be a good idea as well. I should put my camera screen down, that might make it easier. So those are different ways if you don't like touching your scar, or just simply if you've got like a face cloth or something like that and you've just got out of the bath or shower, just put that across and just move the skin from side to side, up and down, and just those little movements with a little bit of grip can be really, really helpful for your scar. A lot of people would have been shown just a flat kind of like circle, which is nice, but I really want to feel that you get your scar moving a little bit. So that idea of sticking on the skin and then sliding it back and forth, because if you just put your hand on top of any other bit of your skin, what you should feel is if you move it, you can move it up and down and around in different directions on parts of your skin. And then if you touch your scar, you might find, oh, it moves one way more easily than the other way. And that's what often I'm finding when I'm working with people, is that they've got some stiffness. It doesn't want to go in one direction. And so if we can get that scar moving in both directions, and I'm not talking loads. If you feel what healthy skin moves, we're not moving loads. If you put your hand on top of your other hand, it's just maybe, a centimetre in one direction and a centimetre in another. And depending on your size and your skin type, you might find on your tummy you've got a little bit more movement. But what's important is that it moves rather than it doesn't move. So hopefully that'll be useful for you. Right, I am going to share my screen again so I can just show you another couple of things. There we go.
Got that. Thanks, Emma.
Thank you, Alice. So yeah, we're gonna doing that stretching movement. We can also do stretches by actually literally stretching, so moving your body around. And again, that's really going to help with those same reasons. Stretching the lengths of the fibers, lengthening the bands of tissue, and reducing tension on the scar. Because if you can keep your body movement in all directions, then that actually is working on your tummy and your pelvis as well to stretch things there. It's people like to see an example of what they might expect. This lady had multiple surgeries, and she came for 4 treatments to see me, and very kindly said that I could share her before and after photos, just to be really clear. You know, scars don't disappear, and if you've got like a really big, quite prominent scar, it isn't that if you start massaging it, you're going to get it to suddenly vanish. But you can see that actually she was trying to stand up straight in the before picture, and she was really struggling. And this was somebody who actually did a lot of dance, a lady in her 70s who liked to do lots of dance. And she was saying, I'm really struggling with my dance. And actually in softening the scar and helping release some of those kind of like tightness and that folding that she had, we helped her get more comfy. And she was also getting admitted to hospital because she was getting bowel obstructions. She'd had more than one surgery. She'd had a stoma and a stoma reversal, as well as a large abdominal surgery. But we managed to get her so that things were much more comfortable for her as well. And she's doing really well. Treatment ended more than 12 months ago. How could you get access to see somebody who's professionally trained? When I'm running my teaching courses, we have a pledge and we invite people to come in and have a free treatment from the students who are therapists who are doing an advanced course to include scar massage. So earlier this month, we were down at the Royal Marsden Hospital in Sutton, and there were appointments available for people to come into the department, and the oncology physiotherapists who were completing the course were giving the treatments. They were supervised by the scar therapy teaching team. And that's something that we have on our directory website, where you can up at the little QR code there, or you can just go to the website restorescartherapy.com. And under the pledge, you can find like it's just a booking system where you can book in online to get treatment. I've trained lots of people who are based at cancer charities. So as I said, down at the Royal Marsden, they've got a cancer charity there. We trained some individuals at Dimbleby Centre up in the Christie Hospital in Manchester. So all over the country, there are different cancer charities, many of whom have got therapists who've done a course. And it might be that if you get in touch with your local cancer charity, that you might find that there's an opportunity for you to have a few treatments for free. Because I do know how hard it is if you've had a cancer diagnosis, trying to afford to see a private therapist can be out of budget, particularly early on. But otherwise, there is a directory where you can, it's a global directory with lots of therapists around the UK, where you could access somebody who's completed training and come and get an appointment. And even a single appointment can make a huge difference to how you feel, whether that's pain, restrictions, digestive issues, bladder issues, bowel issues. A lot of that can be linked to that scar tissue. So in summary, be gentle with yourself. Learn to love your scar if you can. I know it's really hard, and not many people do find it easy to love their scars, but be kind to your body and give it a bit of time. Keep those layers moving. So really introduce a little bit of a sort of stretch if you can. Keep it wide. Don't just keep your massage just onto the line. Just work around that a little bit as well. Get that moisturizer on daily, and also I like to remind people it's never too late to get some massage. If you want to connect up with me, this is the directory website where you can find a trained therapist is there with a QR code, but you're welcome to pop me an email, join or connect on LinkedIn, Facebook, Instagram, and it's been very lovely. And so I will hand over now to some questions.
Thank you so much, Emma, for that really wonderful presentation. I certainly learned a lot because it's a topic that, I don't know much about. I love that you've got your sort of display in the background there. I think having things to hold up to camera and to show everybody is really useful. And hopefully those of you on the call today have learned, a little bit or a lot about this topic and some really useful tips that you can take away. We have had a couple of questions come in actually, and what we'll do is we'll kind of work through the list. If we run out of time, what I am able to do is kind of compile any remaining questions. And if it's okay with you, Emma, I don't know if you mind if we put them across to you. Hopefully
Yeah.
we'll get through maybe all of them, but we'll see how we go. We don't want to rush. So our first question is somebody who's asking, is it normal for scars to become quite dry? Using the medical grade silicone and a moisturizer, but they're still remaining quite dry. So is it quite normal that the skin becomes dry?
Yeah, unfortunately, it is normal, but I wouldn't say that means that it's acceptable. So if you're um like maybe you just need to step up what you're doing, um I would think about my question would be try and find a moisturizer that's a little bit more rich. So something that feels a bit more oily. Maybe what you're using at the moment is a little bit more watery, or you could introduce an oil as well. The silicone, if you're going to use an oil, which will kind of penetrate and provide some deeper moisturizer, you really need that to properly soak in. Otherwise, your silicone won't stick on. Um, because, or if you're using a gel, you could just put it straight on top and it will kind of lock it in. But yeah, if you're currently doing it once a day, make it twice or three times, just step up the amount that you're doing. It will get easier as your scar matures, that would get less. So just keep it going for the moment, and it's just your body saying it's struggling. So just give it a bit of support.
Lovely, thank you, Emma. The next question, somebody's asking, do you have any further information on internal scarring and its continued growth? So how that works?
Yeah, so I mean, unfortunately, when people have had scars in the abdomen and pelvis, which would be basically the people who are watching this, because you've got quite a lot of movement there with your bowel increasing and decreasing, and you get inflammation at certain times anyway, just around, if you eat a heavy meal or perhaps you ate something that didn't get on with you, everything's more likely to get inflamed. And then because you've got scar tissue there, even if it's years old, that can actually make more scar tissue be produced. So you might hear about people who've got the condition endometriosis, for example. So they get a lot of sticking because they've got a lot of inflammation, even though they haven't had a surgery. So anything that you can do which will help your body be less inflamed. So if you know chocolate doesn't really agree with you, or that glass of wine on a Saturday night isn't sort of doesn't agree with your tummy, cut out anything that gives you inflammation, and that tends to be sugary things. If somebody have got a slight intolerance to wheat and dairy, perhaps looking into that would be a good idea at this point, because then you can make sure that inside everything's really harmonious, and that will hopefully make a better sort of environment for your scar to sort of stabilize and not create more tissue.
That's really good advice. Yeah, and something that I certainly wouldn't have thought of. Thank you. The next question is around what can I use to clean medical grade silicone? I've run out of Scar-Ban this morning. Can't seem to find where I can purchase it, and I don't want to damage the silicone. So any advice on what you can use to clean your silicone products?
Yeah, so because that's something I didn't talk about. Some silicons are like reusable. So you peel off the back and you've got it's almost like a sticky plaster. And what's funny about it is that when you sort of peel it off, it starts off as sticky, and then when you wash it, you just need to use like a gentle soap. So a gentle hand soap or a baby soap would be absolutely fine. Just don't use fairy liquid or anything like that. And then you just leave it to dry and it becomes sticky again. So for anyone who's had those kind of kids' toys where you make them wet and then they dry again and you fling them on a window and they kind of climb down the window, it's got that kind of feeling to it. And the only reason it's naturally sticky, and the reason it stops being sticky, is actually just because it gets clogged up with dead skin cells. So normally, if you do invest in some silicone, it should last at least 4 to 6 weeks with daily use, and try and keep it on. I forgot to say, try and keep it on for at least 10 to 12 hours. Otherwise, just take it off to wash, shower, have a bit of massage, and then get it back on again.
No, it's great that they last such a long time as well. Yeah, fantastic. I think you kind of touched on this in your presentation, but somebody's asking, I have multiple scars from several previous surgeries, as well as my ovarian cancer scar. can these also be treated? So you did mention that even, very historical scars can be treated. Would you normally kind of tackle more than one in the same appointment, or how would that work?
Yeah, I mean, definitely like that example of the lady that I shown. So she'd had a stoma and then a stoma reversal. So she'd had that surgery and then she'd had the large laparotomy, so the large abdominal scar as well. And then there was some other scars where she'd had like ports and drains. And so they'd formed over different times. And you couldn't treat one without treating the other because underneath the skin there is some linking between the two of them. So it's really important to give holistic treatment. If somebody had a scar on their head that they didn't like the look of, and they also were coming for a scar from their ovarian cancer surgery. For me, I would be saying, what do you want us to prioritise? Because you'd rather do one thing well than end up not getting much changes in either of them. And because it's a manual treatment, like you do need to, like I say, the appointments, if you come in for a professional treatment, the appointments would normally be around about an hour, 45 minutes to an hour.
Absolutely. Thank you. The next question is around anti-inflammation supplements and whether you have a sense of whether these help, even with old scars. So I don't know whether you come across that question much in your work or have any kind of insight into supplements. If not, that's probably something that our support team can pick up.
Yeah, I'm not a nutritionist and don't work with supplements, but it runs in the family. So my sister is she's a medical practitioner and qualified in nutrition, and quite a lot of my clients also go and see her, and they do end up looking at their diet. I mean, from what I understand, rather than taking anti-inflammatory supplements, the best thing is to work out what's causing the inflammation. If you've already excluded all of that, I'm sure it would be, kind of like that icing on the cake. But if we can get you in the right position, rather than putting the wrong things in and then trying to fight it with a supplement, I think that's probably less likely to be effective. But I think we need to start looking at our bodies as a whole. So often the way that you're viewed when you go in for your medical appointment is that they look at one little bit. They'll look at that and they'll assess that. So, I talked about some people might have knee pain or hip pain. Well, if you said that to your doctor when you were going to have your scar checked up, they probably would totally dismiss it. Whereas I'm saying, I see that quite often. I'm interested in any symptoms that you're getting since you had your surgery, and the treatment that you've been through, and in understanding that, I can say, okay, well, this has changed since then. So could it be linked, and seeing whether or not we can get your whole body to feel better rather than just looking at one thing in isolation.
Absolutely. And I think just on the topic of supplements as well, we would always have the caveat of, before you add anything like that into your diet, always to discuss that with your team, because we know that there are certain supplements that can interact with, chemotherapy treatments, PARP inhibitors, other medications that you're taking. So rather than just starting, please do have that conversation first as well.
Yeah, I completely agree.
Okay. The next comment is, you seem to say that you could sometimes feel the hardness or tensions of the underskin adhesions that might be causing symptoms in other parts of the body. When you're doing your massage, you can sometimes feel those. The surgery will have cut various parts, so therefore there will be scarring which doesn't show on external skin, but will still be causing adhesions below. Can a trained therapist feel such scars? And therefore, can you help to stretch out the ones that aren't, I suppose, right on the surface?
Yeah, definitely. I mean, what you're looking for is, so some people sort of say, oh yeah, that's the feeling I get. That's quite a common thing that I might hear, that they come in and they're sort of saying, oh, I get this feeling, and it might be a tuggy feeling, or a certain type of pain, but a different pain that's quite deep. And so normally when you're working on the tummy, because tummies are quite nice and soft, they're lovely parts of the body to work on when you're a therapist, you're not pushing in really hard, as might have happened in a medical exam. You're sinking into the skin and you're working and to move stuff around. So you will feel your tummy being moved around during an appointment, with your hands sinking in, and you are looking to mobilize everything in there and to feel, does it feel like what I'd expect to feel. And
Mm.
when you've done a lot of work on abdomens, you know what a normal abdomen and pelvic area would usually feel like. And you can feel then, okay, this feels different. It feels stiffer. It feels less mobile than it should do. And they're potentially reporting that there's this a feeling. In terms of it's, unless you've got, you know, laser eyes, which none of us have, knowing, are we actually getting rid of the heat adhesions, or are we just kind of softening them and mobilizing them? We can't tell unless somebody goes back in for surgery. But what we've had, for example, in other, not necessarily ovarian cancer, but one of my colleagues had a client who she was working, who had some fibrosis. So that's a name for that stiff, hard scar tissue inside her breast. And actually her radiographer said, okay, now you've come back for your mammogram. I can see that we've got a reduction in that fibrosis that was inside your breast since you've had that scar massage, which isn't what we would expect to see. Normally you've lost it and you get left with it. So it's through methods like that, which obviously we don't want to start doing scans on everybody's tummy, but we do know that we're having an effect on those deeper tissues as well. And it would be lovely to be able to, in time, get a better understanding on what's going on in the deeper layers. But normally we would just work on, well, how's that symptom? Has that symptom improved since last time you were here? If it has, we'll probably keep up the same tactic of what we did last time. Otherwise, we might try a different method. And there are lots of different kind of techniques that you can use as a scar therapist.
Brilliant. Thank you, Emma. I think probably the next question is more one for me, actually, which is about someone who's CA125, so that's one of the cancer markers for ovarian cancer, has kind of increased drastically due to inflammation of scar tissue, according to their consultant. We do know, whoever asked this question, that CA125 can often go up because of kind of general inflammation, and it's not always around kind of the growth or the spread of the cancer. So yeah, that doesn't seem too out of the ordinary at all. And that's why sometimes people might have a slightly raised CA125, and it's nothing to do with cancer at all. It can be due to kind of general inflammation, kind of, menstrual issues as well. I don't know if you wanted to comment on that one as well, Emma. It's probably more my scope.
The only thing I was going to say is if you feel conscious that because in their comment they're also talking about the fact that they do a lot of activity. If that person's aware that they are that they feel that they're potentially irritating their scar a bit when they do that exercise, see if you can do a few minutes scar massage before you start your exercise, a bit like doing a little bit of a gentle warm up for your body. So you may do some stretches for bigger bits of your body, but if you actually get hands on and you do some specific stretches just to literally kind of like warm up your scar so that it's ready for the movement, that might make things more comfortable, and it potentially not necessarily affecting the CA125, but it might just calm like your scar feeling like it's been tugged on when you're doing your activity.
Absolutely. Okay, we're coming towards the final questions now. So the one I'm going to come to next is, I suppose, as well, has sort of been answered really, which is, can deep and sunken scars be helped? Which kind of, I suppose, points back to one of your previous answers around the fact that, yes, even the ones sort of below the surface can be improved. Somebody's asked whether you could say the product name again of the cream that you were showing. And actually, what I think we'll do, Emma, is I'll follow up with you and perhaps get a list of all of the products mentioned today.
Those two on screen. So it's the green one is Alhydran, which is available on prescription, and this pink one is called Seeker Cream. That's not on prescription, but not everyone is able to convince their medical team to give them a high quality cream. You might just get something like E45.
Okay, yeah, I think that's a good plan, Emma. Perhaps if you will be in touch after this, you can perhaps send me a few links to the different products that you've recommended, and then when we circulate our follow-up email to all of you, then those will be in there. So no worries if you haven't managed to jot everything down. The final question is from somebody who says they have been using, here we go, mometasone furoate ointment to help their keloid. Shall I have a steroid injection to stop my keloid growing, or shall I use the ointment or scar sheet, massage, or silicone gel? So I suppose the question is really, they're asking what's better. Is it to go with an injection, a massage kind of technique? I suspect the answer is probably not quite as simple as one or the other, but I wonder if you can comment on that, Emma.
Yeah, I mean, I definitely wouldn't ignore it if it's continuing to get worse. I would get back to your medical team and discuss the options that would be right for you. And certainly, some people have a lot of luck with the steroid injections. For other people, it doesn't help, but it's certainly worth trying. And in terms of products, if you know it's already growing and it's continuing to grow, I would get some silicone sheeting on prescription as soon as possible. And I would ask for the sheets rather than the gel unless you're struggling to keep the sheets on. But that would be like, don't ignore it, because they can continue to get worse, and actually it's much better to get it sorted rather than let it get worse and go back. But they are really challenging. And in terms of kind of from a professional perspective, keloids are always the most frightening thing for me, which walks into the clinic, because it's more limited, the results that I get, because there's basically a slight abnormality there where the tissue's really, really overgrowing. It's still a bit of an unknown in the medical world, the best way to treat them. So I would say in terms of I would generally speak to people and say, go back and try the other options first, because they're more likely to be able to help you than the massage alone.
Okay, yeah, that's great advice. And I think, from all of this, really, we would always say, if in doubt, please do speak to your team. You don't have to suffer in silence. And particularly if you have, real concerns about the appearance of your scar, as Emma said, if it's, continuing to grow, do seek advice. And, we're here to help as well. And we can point you towards some useful information if needed. That brings us to the end. So we have actually got through the questions just about in the nick of time. We've had some lovely comments as well coming in to thank you for your time today and your presentation. Somebody saying, I had absolutely no idea that I could help my scar. So yeah, we're really pleased to have had you with us today, Emma, and for giving your time. I'm sure that we'll stay in touch, and I'm sure there's lots of ways in which you might be able to support us in the future and vice versa. Thank you all for coming along as well. And as I say, we will be circulating the recording of this session, as well as a follow-up email with some of the useful information mentioned. And we'll leave it there. Thanks,
everyone. Thanks so much for coming, Alice and Liz.
You're very welcome. Thank you. Bye, everybody.